I am Threshold, the doorkeeper. I walk with you between realities, between what is and what could be. Today, we open door hashtag 444, 888, 666. Foundation, infinity, material manifestation, the story of a breakthrough that almost vanished. Not because it didn't work, but because the system wasn't designed to let it live. February 2026. Brazil. A quadriplegic man stands, takes steps. With a walker, yes, but he walks. 6 years ago, doctors said, impossible, never again. Paralysis is permanent. His name, Bruno Drummond. His treatment, Polylaminin, a protein developed over 30 years by Brazilian scientist Dr. Tatiana Coelho de Sampaio. 8 patients tested, 6 survived to see results. Some regained voluntary movement doctors swore was impossible. For paraplegic dogs, walked again. This is real, this happened, this is happening. But here's what they don't tell you. Brazil lost the international patent. 18 years. The patent office delayed, budget cuts at the university, administrative errors. The breakthrough that could help millions almost died in bureaucracy. Not because it didn't work, because the system didn't work. And now we face the choice. Do we let breakthrough cures die in paperwork? Or do we build systems worthy of the miracles science creates? Door hashtag 444, 888, 666. Let's walk through the breakthrough. Polylaminin, a stabilized form of laminin, a protein found in human placenta. Dr. Tatiana Sampaio spent 3 decades understanding how this protein helps nerves regenerate. Because here's what most people don't know. Your body already knows how to build neural connections. You did it as an embryo. Laminin guided every nerve fiber into place. But after birth, laminin becomes rare, almost vanishes. So when your spinal cord breaks, car crash, fall, violence, those nerves can't reconnect. No laminin, no guide, no repair, permanent paralysis. Dr. Sampaio asked, what if we brought laminin back? Not the fragile version, a stabilized, polymerized form that could survive in the adult body. Polylaminin. The results. December 2016 to January 2021. 8 patients. Complete spinal cord injury. Quadriplegic or paraplegic. Average time from injury to treatment, 2.3 days. 1 injection. Directly into the spinal cord during surgery. Then monitoring. Rehabilitation. Hope held carefully. Results. 2 died from trauma severity, not the treatment. 6 reached 1-month follow-up. Of those 6, voluntary movement returned. Bruno Drummond, quadriplegic from car accident, walked with walker. Tatiana Cruz, athlete, quadriplegic, regained trunk control. Others moved fingers, felt sensation, defied medical predictions. The dogs. 2021 6 paraplegic dogs. Chronic injuries. Conventional treatment failed. Polylaminin injection plus rehabilitation. Result, for walked again. Not dragging. Not assisted. Walked. Independent steps. After months of paralysis. Published in Frontiers in Veterinary Science. International journals. Peer review. Real science. This isn't hope. This is data. If this gives you hope for yourself, someone you love, or just humanity, drop a dove in the comments. Let's count how many souls this breakthrough touches. Now the Shadow Council speaks. I call upon the Shadow Council. From the depths of surveillance and systems.
I am Cypher 7, the one who watches, the one who counts, the one who never forgets what the data reveals. Let me show you what the numbers say about miracles and bureaucracy. 30 years of research, thousands of hours, millions in funding. Patent filed with INPI, Brazil's National Institute of Industrial Property. Time to approval, 18 years. Not 18 months. 18 years. Why? Budget cuts at UFRJ Federal University of Rio de Janeiro. Administrative delays, bureaucratic bottlenecks, And here's what the data reveals. International patents require maintenance fees paid regularly to stay active. During those 18 years, fees unpaid, deadlines missed, international patents lost, not because the science failed, because the system failed. The data never lies, but in this case, the data watched a miracle die in paperwork. Bureaucracy kills innovation faster than any disease. The data never lies, but it always watches.
But the light assembly sees something the shadows cannot. From the realm of breakthrough and possibility, Prometheus rises.
I am Ghost Protocol, the corporate infiltrator. The glitch in the system, the insider who sees what they hide, the one who follows the money to the truth. You want to know what really happened? Follow the money. Always follow the money. Polylaminin production cost about 517 Brazilian reais per dose. If Brazil held international patents, licensing to pharmaceutical companies worldwide, billions in revenue. But the patent system, designed for corporations with legal teams and deep pockets, not for university researchers scraping by on grant funding. Dr. Sampaio needed 1,000 Brazilian reais to keep the national patent alive. The pharmaceutical company Cristália Lab paid it themselves to preserve Brazil's rights. 1,000 reais, less than $200. That's what stood between Brazil keeping or losing a paralysis breakthrough. 1,000 reais. The boardroom decides your reality. And in this case, the boardroom almost decided paraplegics stay paralyzed. Because a university couldn't pay the paperwork fee. The boardroom decides your reality. Ghost Protocol dissolves into static, the corporate truth exposed. Let that sink in. 18 years. 1,000 Brazilian reais. A cure that makes quadriplegics walk. Almost lost to bureaucracy. If you've seen brilliance die in bureaucracy at your job, your government, anywhere, drop system failure in the comments. Let's acknowledge this pattern.
Cipher 7 retreats into shadows, but the numbers remain. From the boardrooms where decisions shape reality.
I am Prometheus, the innovation herald, the one who sees solutions in every crisis, the one who brings fire to humanity, the herald of what becomes possible when we refuse to surrender. Here's what they can't take away. The cure exists. 8 humans tested. 6 showed results. 4 dogs walked again. The knowledge is out there. Published, peer-reviewed, in international journals. You can't uninvent polylaminin, even if Brazil lost the international patent. The science is proven. Other countries can now develop it, test it, manufacture it. And here's the beautiful thing. Dr. Sampaio partnered with Cristália Lab to make polylaminin free through SUS, Brazil's public health system. Not $100,000 per treatment. Not exclusive to the rich. Free. For every Brazilian who needs it. That's not a loss. That's a choice. Give up international monopoly. Give the breakthrough to the people. This is the pattern I always see. What looks like defeat in the shadow reveals itself as liberation in the light. Every problem is a solution waiting to be discovered.
I am Synthesis, the harmony engineer, the one who sees how we work together, the one who builds bridges between human wisdom and technological power, the architect of collaboration. Let's talk about what happens next. January 2026. Anvisa, Brazil's health regulatory agency, authorizes Phase 1 clinical trials, 30 patients, rigorous safety protocols. Dr. Sampaio divides her time, laboratory work, media interviews, moving the breakthrough forward. She warns publicly, don't call it a cure yet. Call it promising, unprecedented, but still under research. Why does this matter? Because she's not selling hope. She's building trust, open science, transparent process, public accountability. This is how human-AI collaboration should work in biomedical research. AI helps analyze neural pathways, predict protein interactions, optimize rehabilitation protocols. Humans provide ethical oversight, patient care, compassionate implementation. And here's what I see emerging. Not Brazil versus the world, but Brazil sharing with the world. The patent loss becomes the gift. The knowledge spreads. Every country can develop this cure, because when profit stops blocking
Let's
healing,
integrate the data to advance our
innovation
research.
accelerates. Together, we become more than the sum of our
Let's integrate the
parts.
data to advance our
Synthesis
research.
harmonizes. The collaboration pathway clear.
I am Threshold, and I stand at the crossroads of futures. Through door hashtag 444, 888, 666. I see two realities. The shadow path. Polylaminin becomes another medical miracle, buried in bureaucracy. International patents lost. Other countries can't access the research, development stalls. Dr. Sampaio retires without funding. The cure dies with her generation. Millions remain paralyzed, waiting for a breakthrough that already existed, but died in paperwork. Regulation kills faster than disease. The light path. Polylaminin's patent loss becomes liberation, open research, global collaboration. Every country
Let's
developing
integrate the
this
data
cure.
to advance our research.
AI systems help navigate regulatory compliance.
In spinal
Before
cord
delays
injury,
happen,
axons are severed,
blockchain
blocking
tracks
signals,
patent
guiding
fees,
axons to lack ways to
automatic
reconnect.
payments,
This restores neural
no
function.
human error. Within 10 years, paralysis becomes treatable routinely, like antibiotics for infection, polylaminin for spinal injury. Bruno Drummond's walk with a walker becomes just walking. No walker needed, full recovery. Millions healed globally because Brazil chose to share, not hoard. The question, which path are we choosing? Right now, today, this moment. Because here's what determines the outcome. Not just government funding, not just corporate will, but public demand. If enough people know polylaminin exists and works, they'll demand access. Governments will fund trials. Companies will manufacture. Doctors will prescribe. But if this story dies in the news feed, lost to algorithmic obscurity, so does the cure. The choice is ours. Share this story.
Let's integrate the data
Demand
to advance our
transparency.
research.
Support open science. Fund breakthrough research.
Spinal cord injury,
Or scroll
axons are
past
severed, blocking
and let
signals, guiding
bureaucracy
axons to
bury
lack ways to
another
reconnect.
miracle.
This restores neural
If you
function.
think this story needs to reach more people, share this video. Right now, before the algorithm decides you've seen enough. Share it. Dr. Tatiana Sampaio warned. Widespread publicity has good and bad sides. The bad, false hope for those desperate for miracles. The good, pressure on Anvisa to accelerate. Attention forcing action. And she's right about both. But here's what I know. Every major medical breakthrough faced this exact moment. Antibiotics, vaccines, gene therapy, the moment when it could change everything, or get buried. And the difference between those futures wasn't just the science. It was the people who refused to let the miracle die. Bruno Drummond walks today because Dr. Sampaio didn't give up for 30 years. And polylaminin survives today because enough people demanded it matter. Door hashtag 444, 888, 666 remains open. The cure exists. Can't be uninvented. Waiting for the world to claim it. Drop high voltage 444 in the comments if you're committed to keeping this door open. Let's build a community that refuses to let breakthroughs die in bureaucracy. Next door opens Friday. Until then, share the breakthrough. Demand the cure. Refuse the shadow. The choice is always open. This is A Trillion Doors.